Hi there, my name's Mike Butterworth. I'm the massage therapist here at Leeds Physiotherapy Clinic. Just demonstrating a few techniques which may or may not be appropriate for you if you come for treatment here. We get a lot of runners. Runners build up quite a lot of tension in the lower leg. So here are a couple of techniques which we might employ if you come for treatment. The first one we're going to do is for this shin muscle here. Quite often the running action built up quite a lot of tension in the front of the shin. So we use some techniques on the muscle that we call tibialis anterior. So a common one we will use is to actually push the tibialis anterior muscle across the fibers. So the fibers of the muscles are running from top to bottom. Oftentimes, if we want to mobilize a tissue and stretch the fascia, we quite often work across the fibers. So I'm just digging in to the side of the shin bone, a gentle pressure at 45 degrees to the muscle, and then just rolling around. That feel okay, Shika? So it's a really nice technique. Again, like all the techniques, we'll start quite gently. And as the tissues yield and being guided by the comfort of the patient, we can over time just build up the depth of the technique. Quite often we'll just reinforce that with a basic effleurage stroke, which is taking fluid up the leg just to ease off after a treatment, and then again we'll return and do a few more of those movements across the fibers of the muscle. So that's one technique. Another one which we'll commonly use, and it's a technique we use to help with the long toe flexor, which is obviously going to be really responsible for pushing your foot off while you're running. And the long toe flexor actually runs at the back of the shin. So what we'll do is we'll just get a thumb in at the back of the shin bone and trace the root of that muscle all the way up to the back of the knee. What does that one feel like, Shika? You're right. Can be quite tender. This is obviously the area some people get affected by shin splints. Oftentimes, if we can mobilize the tissues earlier and get in there where before symptoms have come established, we can hopefully save people from developing a more serious condition. So again, just a nice bit of effleurage just to finish off. So there we are, just a couple of techniques that we might use if you come for treatment with a lower leg issue.